Hello everyone, I am one of the authors of Global Guidelines for Candida diseases, and the section that I will be discussing is epidemiology. Candida species are globally the most important cause of invasive fungal diseases across various patient populations. Spectrum of Candida infection ranges from less severe infections such as cutaneous or mucocutaneous to life-threatening severe infections such as systemic candidiasis or invasive candidiasis and candidemia. The latest estimates show that around 1.5 million cases of invasive candidiasis occur yearly. Candidemia is the most frequent presentation of invasive candidiasis, and most cases are healthcare associated, specifically with Candida parasilosis and Candida auris. The risk factor for invasive candidiasis include broad-spectrum antibiotics, blood transfusion, Candida colonization, central venous catheters, and total parenteral nutrition, specifically in critically ill patients. Talking about candidemia, the risk factors include use of steroids and other immunomodulatory drugs, comorbidities such as diabetes or chronic kidney disease, extremes of ages, abdominal or cardiovascular surgeries, and prolonged ICU stay. A recent meta-analysis has shown that patients of invasive candidiasis, if they have received steroids, they had a significantly higher risk of death compared to those who did not receive steroids. There is genetic predisposition for candida infections, and SCARD9 deficiencies and STAT1 mutations have been reported to predispose for candida infections. Globally, an increasing incidence of candidemia and invasive candidiasis has been reported. The distribution of predominant candida species varies substantially by patient population and geographical region. Incidence of candidemia has been reported to be higher in patients with hematological diseases, ICU patient, advanced age, premature and extremely low birth weight neonates. Estimates conducted during 1997 to 2020 report an incidence between 1.9 to 14.1 cases per 100,000 population per year. Despite significant differences between the two biological sexes in Candida infections, most studies have not presented the data on sex. Only a few studies explore the importance of sex on disease pattern or clinical outcome. A study has reported that denture wearer females have a higher rate of yeast growth in oral cavity compared to males. It is well known that estrogen promotes the candida colonization in vaginal mucosa, increasing susceptibility to vulvovaginal candidiasis. Studies have reported a more severe and worse outcome in men who suffer from invasive candida infections. So, data on this attribute is not well presented, and future studies should explore this difference. There is a significant variation in candidemia and species which cause candidemia in various parts of the world. Candida albicans has been reported to be the most predominant species globally, followed by Candida glabrata, Candida tropicalis, Candida parasilosis, and Candida krusei. Lately, a proportional increase in Candida glabrata and Candida parasilosis has been noted around the world. A note of concern is that fluconazole-resistant Candida parasilosis is also increasingly being reported, resulting in outbreaks in healthcare settings. And recently, emergence of multi-drug and pan-drug resistant Candida auris across the globe is another threat, and lately this organism has been highlighted as a critical importance in the WHO fungal priority list. Next few slides will show maps on the epidemiology of candidemia in various countries, and they will highlight the distribution of species in different countries. So if you can focus on this slide, this slide show data from Europe, and if you note that regions with in the northern Europe, they have a predominance of Candida albicans followed by Candida glabrata. You can see in the data of Iceland, Republic of Ireland, Netherlands, France, Denmark, and the UK that the second most common cause of candidemia in these countries is Candida glabrata. Whereas if you can look in Spain, Portugal, Greece, Romania, Candida parasilosis is second most common cause, and rather in Romania it is the most common cause of candidemia. In Middle East, again Candida albicans followed by Candida glabrata is the major cause of candidemia. In certain countries of Asia such as Pakistan, India and UAE, Candida tropicalis is the most common cause of invasive candidiasis and candidemia. In Bangladesh, Candida parasilosis is the most common cause of candidemia, and in Indonesia also. In Australia, the data is similar to Northern Europe and USA, and here Candida glabrata is the second most common cause of candidemia. In Africa, in certain countries there is predominance of Candida tropicalis, similar to some countries in Asia. So in Algeria, Tunisia, in Egypt, Candida tropicalis is more prominent and more important cause of candidemia. In South America, Candida albicans and Candida parasilosis are the more predominant causes of candidemia. And Kenya, there is a high proportion of Candida auris and Candida parasilosis, suggesting poor infection control practices. Talking about Canada and USA, there is predominance of Candida albicans followed by Candida glabrata. In some countries, in Mexico, for example, you can see that Candida albicans is followed by Candida tropicalis and Candida glabrata. In Chile, in Argentina, in Brazil, Panama, Costa Rica, and Venezuela, Candida parasilosis is a significant cause of Candida infections. Thank you very much.